Hello, everyone. I am Daisy Ramirez-Ortiz, a postdoctoral associate in the Department of Epidemiology at Florida International University. I received the FIU RCMI Pilot Award in 2021. My pilot project focuses on retention and re-engagement in HIV care among Latino immigrants. In this presentation, I will provide an overview about this ongoing project. To provide you with a brief background, people with HIV who are not retaining care account for over 60% of new HIV transmissions in the United States. Therefore, preventing people with HIV from leaving care and re-engaging those who have dropped out of care is critical to control the HIV epidemic in the United States. However, an estimated 41% of Latinos are not retaining care. One study in Florida conducted by our team shows significant disparities in retention by birth country subgroups of Latinos, with Latinos born in Mexico and Central America being more likely to not be retaining care as compared to Latinos born in the United States. Our goal with this pilot study is to examine multi-level barriers to retention and re-engagement in HIV care among Latino immigrants who have dropped out of care in Miami-Dade County, Florida. Also, to examine longitudinal patterns of engagement in HIV care among Latino immigrants to identify those specific subgroups at high risk of disengaging from care who may benefit the most from re-engagement interventions. We will use these findings to inform the adaptation of the CDC evidence-based intervention, Antiretroviral Treatment and Access to Services, ARTAS, to facilitate re-engagement into care for Latino immigrants. We're using in-depth interviews with Latino immigrants who have dropped out of care and key informant interviews with providers such as case managers to identify barriers to care. So far, we have conducted 11 interviews. Some of the barriers to retention and re-engagement stated in the interviews conducted thus far include undocumented status, unstable employment, conflicting work schedule, housing instability, moving from place to place, difficulties meeting program paperwork requirements, lack of transportation to attend medical appointments, mental health issues, substance abuse, and fear of acquiring COVID-19 in HIV clinics when attending medical appointments. Through a group-based trajectory modeling of Florida statewide HIV surveillance data, we're examining longitudinal trajectories of engagement in HIV care among Latino immigrants. Our sample includes Latino immigrants newly diagnosed during 2015 and 2016, and we're following them for 3 years to identify the subgroups at high risk of disengaging from care who may benefit the most from the adaptive re-engagement intervention. In phase 1 of the quantitative analysis, we found 3 distinct trajectory groups of HIV care engagement in our cohort. One, consistently high retention, and 78% of our cohort followed this trajectory. A steadily decreasing retention, and 5.7% of our cohort follows this trajectory, and consistently low retention, and 16% of our cohort follows this trajectory. In phase 2, we're working on identifying sociodemographic and clinical predictors associated with suboptimal care engagement trajectories, so we can identify those subgroups that are at a high risk of disengaging from care. So based on these findings so far, we can see that Latino immigrants face unique barriers and some have suboptimal patterns of HIV care engagement. They are in need of culturally adapted interventions, and we hope that by adapting ARTAS intervention to facilitate re-engagement and retention, this may help to address these unique barriers that Latino immigrants face and improve care engagement rates among Latinos. I would like to thank FIU RCMI and NIMHD for funding my pilot project. Also, a special thanks to my mentors, Diana Sheehan and Mary Jo Trepka, and my collaborators, Stephanie, Mariolga, Michaela, and Priscilla. Thank you very much.